Okay, we're back over here at the Smith machine. I think I use the Smith machine as everything but a Smith machine. So I just like that we can come up on different levels. That's what makes it really handy for me. So what we're going to do here is we're working more on the posture. Okay, there's two different movements that I really enjoy doing with this. Okay, so what we're going to start off at is we're trying to regress and progress our patients. So if you start up higher, okay, that would be considered a regression for this exercise. Bringing it down lower is progression, right? So what we're doing is we're going to start with some low rows, okay, overhand or underhand. Okay, again, if you get underhand, you're going to work more of the biceps. Okay, so if your patient, could use a little bit of that, pulling, strengthening, that would be a good option. I prefer going overhand just because, those are kind of the muscles that are more important for, that posture and that good stability for the AC joint. Okay. So we're going to come down, they walk down here. Okay, we're going to start with the low row. So low row, we're kind of aiming at getting our elbows to come out here to our sides. Okay, so an important cue when doing this is making sure that the patient is making their elbows do all the work. Okay, if you advise them to use their elbows during this exercise, it kind of cuts out the forearms, the biceps, and really focuses just right there on the lats the most. Okay, so we're going to do a little variation of that one. Now we're going to go to high rows. So this one is instead aiming at the posterior delts and the rhomboids. Okay, again, those important muscles for maintaining posture, especially for kyphotic patients, right? So coming down again. And now, instead of my elbows coming out here down to my sides, they're going to come more at an angle. There we go. So, again, to make it harder, I would just lower this down. Okay. Good way to progress and regress the exercise according to the patient's needs. There we go. So we'll go over some more postural exercises in a little bit.